name is Vatsala Bhaskaran. I'm a specialist registrar in respiratory medicine and a clinical research fellow in the East Midlands. Pneumonia is a type of chest infection. It affects the tiny air sacs in your lungs called alveoli. When you have pneumonia, these air sacs get inflamed and fill with fluid. This makes it harder for you to breathe. We will be covering information on community-acquired pneumonia, the type of pneumonia in people who have not been recently hospitalized. Most people with pneumonia can be completely cured, but pneumonia can be life-threatening, and you should take it seriously, even if you're young and fit.
I am 43 from Nottingham, and it's just under 2 years ago that I had pneumonia.
I'm 77 years of age, I come from Derby. I've had pneumonia now for 5 weeks.
There are many different kinds of bacteria, viruses, and other germs in the air which can cause pneumonia. If you're normally healthy, a small number of germs usually do not cause any harm. They will be trapped in your phlegm and be removed by your immune system. Germs can sometimes multiply and cause lung infections or pneumonia. The germs that cause pneumonia, particularly bacteria and viruses, can be passed from person to person. So you may be contagious. However, not everyone exposed to the germ will develop pneumonia.
I didn't suspect it at all until I was taken into hospital, and it wasn't until they told me.
The most common cause of pneumonia is a bacterium called Streptococcus pneumoniae. The main symptom of pneumonia is coughing, and you will probably have at least one of these symptoms too. Phlegm production, a high temperature, where you might also sweat and shiver, difficulty breathing or getting out of breath quicker than normal, chest pain or discomfort, loss of appetite, aches and pain.
I had a chest infection, and that led me to sort of knew something was going off and wrong. It wasn't as well as normal.
Really hot. It was unbelievable, and I genuinely felt the worst I'd ever felt.
The breathing problem wasn't as good as normal. It was very poor breathing. I must say the asthma was getting worse.
Patients who develop more severe illness may have quick breathing, confusion, a low blood pressure, coughing up blood, a rapid heartbeat, nausea and vomiting. A doctor can often diagnose pneumonia based on the symptoms described and by examining your chest. You may also need a chest X-ray to confirm that you have pneumonia. In addition, a doctor may take a blood test, a phlegm sample, or a urine sample. Symptoms of pneumonia may gradually develop over a few days or progress much faster. Pneumonia can be serious, so it is important to get treatment quickly. The main treatment for pneumonia is antibiotics. You will be advised to continue with graded activity to avoid both overexertion and underactivity. It is important to drink plenty of fluids to avoid becoming dehydrated. You can take paracetamol to reduce fever and ease most pains. If you have a mild pneumonia, you may be able to manage it at home with a 5-day course of antibiotics in the form of tablets from your GP. However, some people are too ill to be treated at home and need to go to hospital. In hospital, you may receive antibiotics and fluids through a drip in your arm if you're too ill to drink or take tablets. You may also need supplementary oxygen if your oxygen levels are low. The hospital staff will regularly check your temperature, breathing, heart rate, and blood pressure to see how you're doing. Overall, you may need to take antibiotics for 7 to 10 days in total, but you would not necessarily have to stay in hospital for that long. You can develop pneumonia at any age. Each year in the UK, out of every 1,000 adults, about 5 to 11 people develop pneumonia. Some people are at higher risk of developing pneumonia, including babies and young children, people over the age of 65, people with long-term medical conditions, people with cancer, especially those having chemotherapy, people who smoke or drink excess alcohol, people on drugs that suppress the immune system, and those with HIV. There are many things that you can do to reduce your risk of pneumonia. Firstly, practice good hygiene. Use a tissue when you cough or sneeze and throw it in the bin straight away. Secondly, keep a healthy lifestyle by exercising where possible, eating a healthy diet, and avoiding tobacco smoking or excessive alcohol. Smokers have an increased risk of developing pneumonia as it damages your lungs. If you smoke, the NHS Smoking Helpline offers advice and provides support to help you stop smoking. Thirdly, get vaccinated. Your GP should be able to advise you whether you are eligible or not. The available vaccines aim to protect people who are at higher risk from pneumonia, including older adults and babies. Once you start taking antibiotics, your symptoms should begin to improve. Recovery times vary a lot from person to person and depend on your age, your general health, and how severe your pneumonia is. Although it's impossible to say how quickly you would recover, here is an idea of what to expect. Within 48 hours of starting antibiotics, your temperature will start to settle, and after a week, your fever should be completely gone. After 6 weeks, you'll be coughing less, and you'll find it easier to breathe. If not, then please see your GP. By 3 months, most of your symptoms will be gone, but you may still feel tired. By 6 months, you should feel back to normal. If your symptoms are slow to disappear, if you're over the age of 50, and if you smoke, you should have a chest X-ray 6 weeks after you've started your antibiotics. This is to ensure that the infection has gone from your lungs. The vast majority of people recover from pneumonia and return to good health. However, pneumonia can be serious, and some people with severe pneumonia do not recover despite the best available care. If you develop pneumonia more than once, then you may need more investigations to understand why this is happening. It may be due to an underlying problem in your chest or your immune system, and you may be referred to a specialist. If your temperature comes back despite antibiotics, or if you get worsening breathlessness or chest pain, then please see your GP or go to your local emergency department. However, if lack of energy is the only symptom that you have, this is a common symptom that many people experience irrespective of their age and pre-existing illnesses. In this case, you must rest more and listen to your body. It will tell you if you're doing too much.
It took over 5 weeks I could get back to work. Still feeling quite tired for a couple of months afterwards, but the breathing got better obviously within that time. If you can't wash the pots, if you can't hoover, don't worry about it. Sit down, you will be exhausted, but it will get better.